Good Friday afternoon, and thanks for joining us. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at the Knox County Health Department. This one's going to be a long one, folks. Our moment of gratitude again today is for all employers and employees who are taking measured steps to safely reopen for the public. This is a big deal, and we know that. We are so grateful for those who have put together responsible plans to keep their employees and customers safe and healthy. We are also very grateful to the businesses who've chosen not to reopen today because they wanted to spend more time preparing. Remember, again, for phase one, today is the earliest day businesses can reopen in Knox County, but no one is required to reopen. I also want to take a minute to address some questions and feedback we are receiving about faith-based communities and communion. We apologize if anyone misinterpreted the message in our plan. In our original plan, we did not mean to insinuate in any way that communion is not a core value for many in our faith community. And I was horrified to learn that a statement saying that was incorrectly attributed to me and is circulating on social media. I completely understand how important communion is to our faith community. As we mentioned earlier this week, we will continue to encourage our local faith community to follow the state guidance once it's released. And again, we apologize sincerely for this misunderstanding. Now I'd like to address the local order that was sent out to the media late last night. We were made aware yesterday evening by the county's law office that we must have a local order in place today that allows personal care services in Knox County to open, as those businesses are not allowed to open during the until next week in the governor's current order. We apologize for the late release of this order, but wanted to do what was best for our business community and make sure that those personal care services were covered and not in violation of any of the state guidance. We do anticipate an amendment to this order going out later today that will cover Knox County businesses moving forward since the order expires tonight at midnight. Moving on to our local situation. We have 238 confirmed cases of COVID-19 in Knox County. 199 of those have recovered. 34 individuals have been hospitalized at some point in their illness, and 3 are currently hospitalized. And we are thankful to report that we have no additional deaths from COVID-19 today. Now we'd like to spend some time showing you the new resources that are available on our website as it relates to our community's reopening. We'll start with our main reopening page. You ready? Right. On this page, you'll find general information about the Knox County and City of Knoxville reopening plan, including the 5 core principles of the plan that everyone should be following. At the top of this page, you will see 3 blue boxes. The first box takes you to a PDF of the reopening plan, where you can review it in its entirety. As state and federal guidance is released, amendments to our plan may be made similar to how we removed the faith community guidance following Governor Lee's Executive Order 30. Those amendments and updates will be documented on this webpage later today. The second blue box takes you to resources for employers. On this page, employers and employees can see guidance related to steps for reopening. Some of those resources include information on designating a COVID-19 coordinator, signing up for a listserv, and available signage that employers can display speaking to the guidance for the public and their employees. The third blue box. On our reopening page, will take you to our data and benchmarks page. At the top of this page is the data that we have been providing to you every day, and we will continue to update this daily. Scrolling down further, you will see a new section for benchmarks. Decisions on how to move through the process or through the phases, or whether to institute mid-phase adjustments, will not be made based on any one number or figure. Decisions must be made by looking at multiple data points and trends while incorporating public health expertise and developments in science and technology. These decisions are not made in a vacuum and will be made in collaboration with city and county health officials. All of these factors must be considered when determining when and how we will proceed through the reopening process. To more visually represent how the benchmarks are being attained, a traffic light is being utilized to depict the status of each benchmark. Red signifies the trends are not moving forward towards benchmark attainment and may indicate mid-phase adjustments need to be made. Yellow signifies the trends are moving towards or away from reaching a benchmark. Yellow indicates caution. And green signifies that the benchmark is currently met. Today, all of our benchmarks are showing a green traffic light because we met benchmark attainment to begin the reopening process. As a reminder, a minimum of 28 days will be spent in each phase, regardless of whether the benchmarks are met at an earlier time. As new challenges and opportunities arise, it may be appropriate for Knox County Health Department to consider additional benchmarks or to modify the current criteria. Here, we show the 5 benchmarks that we laid out in our plan and the corresponding metrics that we're using to evaluate attainment. Can you scroll up a little bit? Yeah, there we go. Thank you. The first one is our cumulative case counts per day, including a growth rate. If you actually, the yellow portion of the graph shows our new cases, and that's what we're really wanting to look at because that number is going to, the cumulative number will continue to grow. We also show our growth rate from day to day. If you hover over any of those data points, you can see what that is. And you'll see that it's pretty flat for what we've been doing for the past couple of weeks. So that's the first piece. The next one is our epi curve by illness on, or no, actually, I think I'm on the wrong page, sorry. Our test conducted for Knox County residents. This is a sample of the data that we're able to provide for people that live within Knox County that have been tested for COVID-19. This data comes from public health tests that are completed, some hospital tests that are completed, and private providers tests that are completed. It is a sample in that we don't get addresses for all of the negative tests, but these are the ones that we can see. And as you can see, we've been able to show that there has been a dramatic trend in the increase in testing that is happening. And we feel that that's a representation of what's happening across the community as a whole.
Charity, would you like to mention that we have where people can click more for
Oh, yes. So for all of our benchmarks, just to clean the page up and make it easier to read, all of our more information explaining how the data is gathered and where it comes from. If you click on the click here for more information, that information will be available for you. So make sure you look into that if you have a question. Thank you, Kelsey. The next benchmark or portion of the benchmark that we're looking at is the time that it takes us to get test results back. That's really important, and we want to see that time getting better and better. And as you can see on this graphic, it is as well. We're still currently sitting under 3 days. We want that to continue to get shorter, but we're doing a really good job so far, especially if you look at where we were early on for this. So that information is available as well. The third benchmark talks about public health capacity, and that's the capacity for us to do the job of do all of the things that we've been telling you that we have to do in this pandemic response. So that's investigating new cases, that's contact tracing, daily monitoring, there's data entry that goes with that, and data analysis. So what you see here is the amount of our currently assigned team, and that team of 31, we're able to manage the current caseload that we have right now with that team. We have another 20 people trained already and ready to go if we get a huge spike in cases for some reason, and we need to do a lot of case investigations very quickly. So we have about 51 people that are ready to go now. We have additional KCHD team members and additional Knox County team members that can support these efforts that have all been identified to get us at about 247 Knox County team members that can help meet this need. That's well above what we anticipated and what's listed in our plan of needing about 100 to 120 people for this response. The next section, healthcare system capabilities. This is, again, very important. The whole point of us trying to flatten the curve and doing all the work that we've been doing was to make sure that our hospitals were ready to care for the patients that need to be cared for. And they have done a fabulous job. So the data that you see here is from the Healthcare Resource Tracking System, and it's summary data from all of our participating hospitals. That encompasses those 16 county regions, so Knox County and the 15 surrounding counties, and that's about 19 hospitals that are participating in this system and providing us information. They update it every day. We will be updating this weekly. So the first graphic shows inpatients. So these are patients that are actually hospitalized, ICU patients, and patients on ventilators that have tested positive for COVID-19. And again, this will be a weekly metric that we provide, but you can see the trends have been looking pretty good for our hospital capacity. And I do want you to take note at the y-axis to look at what those numbers are. Even if you see a slight elevation, it's still not necessarily a whole lot of patients in the hospital. The second graphic indicates our inpatients that have pending lab results. So it's the same three categories, but showing ones that are awaiting test results. Then the next graphic, we have what our hospital's capacity is and what their current utilization and available capacity are. This is all based on their normal daily census, how they're operating without having a lot of surge plans in place. And that's explained in the graph or in the data clarification point below. And then below that, through the work of our local alternate care site task force, we were able, and the hospitals worked together, and were able to identify additional surge capacity that could be created as needed. And all of that information is available for those three categories for hospital beds, ICU beds, and ventilators on the website. And again, all of these are models are looking, or all of these data points are looking really good and trending in the direction we want to see them. The final one is one of our benchmarks with sustained or decreased COVID-related death rates. We have the data that's available on our daily update for that because we do, and we're very grateful that we have such a low number of deaths. That's not one that we can provide a good, accurate graph or measure on right now. And we're very thankful for that and grateful for that. But we do have the information that's available daily already on the website, so you can at least see what the rates are for the different categories by age or race, gender, that kind of thing. So with that, we'll open it up for questions.
All right. We will get this off the screen so we can see Charity again.
Or you don't have to.
All right, go ahead and submit your questions now, please. First question we have is from WVLT. They ask, is it mandatory for all restaurant workers to wear gloves and masks?
We recommend that they follow the guidance as is outlined in the plan. Mask is required for those workers, and gloves are required as they normally are for their normal daily operations to prevent the spread of disease. And if there's questions from restaurants or restaurant workers, they can talk to our environmental health office and get those questions clarified.
Also from WVLT, how many patients have recovered that were put on ventilators?
I don't have that exact number and that level of detail in the information that we have available today.
From WBIR, you mentioned the 5 core principles that everyone should be following. Commissioner shared concerns this morning about people not actually following them, specifically the ones regarding face coverings. Are you considering an enforceable policy like some cities or businesses?
We're not at this time. Again, I think you can look at what our case rate is and all of the good data that we have to show that the vast majority of people have been doing what we've been asking them to do to help prevent the spread of this disease. And we hope that, and we believe that they're going to continue to do that. We do strongly encourage them to wear the face coverings and follow those. But at this time, we'll be referring back to education more than anything. Yeah, and we do encourage that our leaders continue to model that. We're doing that. If you see me out in public at the grocery store, you're going to see a mask on my face. We just want to make sure that we're modeling that good behavior in the community.
From WATE, what's the procedure for clothing retailers when it comes to trying on clothes? Must those clothes be cleaned between customers?
You know, that's not necessary. We are saying that you need to have a mask on when you go out, and that'll help limit the spread of virus that way. But we also really want everybody to be washing their hands. So make sure you wash your hands before you're trying on clothes if possible, and definitely after, and avoid touching your face and doing all of those things that can help get the virus into your body.
From the Sentinel, you said that you were releasing more comprehensive information about the metrics, models, benchmarks, and data you were using to make decisions today. That information has just been released. Can you please explain the rationale for using these metrics and not others?
You know, we really wanted to look at what worked for our community. We talked to our epidemiologist, and we've looked at what our current situation is. And so there were some metrics. You might see that there's a metric to have a decrease in cases. We never had a spike in cases. And so we've stayed steady and been moving slowly, increasing from day to day. And so we really had to look at what was reasonable for our community. So there was a whole team that was working on this. There's, again, explanations of the data that you look at on our website. I think they'll explain a lot of where that's coming from. But it was really a group effort looking at what what's realistic and works for our community, and the data that we have available, and all of the national standards that are out there.
From WBIR, we were told 500,000 cloth face coverings are coming next week and will be distributed through the health departments. Is that a statewide number, or do you have any additional information you can provide about that?
Well, I think I just showed a surprised face. I did not know that. Did you know that? Okay.
I heard it when they heard it.
Okay, so you heard it when you heard it. That's great news, and we will learn more about that and let you know more as we move forward and into next week. That's news to me, and I think that's communication chains from state and other folks. It might go to different places, and it can be challenging sometimes. So, but I'm happy to hear that. That's great.
From WATE, we're familiar with the restaurant inspection forms that health inspectors use. Is there a similar inspection form for any inspections which might be conducted under the COVID-19 guidelines?
Not at this time. They'll be using their normal inspection criteria, and then just looking for the things that are outlined in the plan that they should be doing in addition to what's on their normal behaviors that they have to look for.
From the Sentinel, how stable do new COVID-19 cases need to be to constitute a green light?
So, and there we can maybe look into and provide more information, because that's our epidemiologist can really explain that, but they are looking at statistical changes in the data. So actually looking at what constitutes a change. Is it one that we need to act on, or is it one that would be expected with what our current growth rate is? We can try to provide more information on that on Monday, maybe have one of our epidemiologists available. But there are calculations behind the information we're looking at. But the other side of that is there's also our public health view of what's happening and what's influencing that data, and with talking with our local leaders on how we move forward through the phases. We need to keep that in mind. Nothing's based on one data point.
Their follow-up question here, and this might be best suited for potentially one of our epidemiologists, like Charity mentioned on Monday, but what does it take for this metric to go yellow or green? And they're also wanting to know how much improvement in testing and testing return time needs to constitute green, or how would it move from yellow to green as well?
I think we're really wanting to look at trends and getting into the nuances of all of the different statistical models and calculations. And this format's probably not the best, and I'm not the best to give you that information. We can talk again, get our epidemiologists to do it. But for the general public, for most people who are looking at this, we want you to be able to see if things are trending up or down, whichever direction we need them to be going. So testing needs to be going up to be able to see how we're doing in our community.
From WBLT, how long is the general public expected to wear face masks?
We don't really have an endpoint on that. I think a lot on that will come with how well we do moving forward. And I can't give you an accurate time frame right now. I'd say to plan on it being a while.
Also from WBLT, is the health department seeing several strains of the virus on a local level?
So right now, everything's the SARS-CoV-2. Thank you. I was about to say that backwards. That's what we're looking at. We're not looking at any specific genetic shifts or drifts or anything like that that's happening. That's at a much higher level, and information we provided on that. We are specifically looking at what we've been looking at from the beginning for our test results and criteria.
From the Sentinel, can you clarify whether gyms can provide group classes if people are socially distanced and wearing masks?
They can, yes.
From the Compass, why are you not using COVID-related illness data? Will that data be released?
So that's the data I did talk about yesterday. We don't have it on the website right now because there's not a good way for us to get it on the website. And so we're working on that. That is a web design limitation because the background data that supports the syndromic surveillance system is a little bit different than what's required or what's needed to be able to make the graphics on our website ADA compliant. So we're working on that, and as soon as we can get it, hopefully we can get it available. You can see it. I can tell you that it looks very similar to the other data, especially if you look at the epi curve. It looks pretty similar to that.
From the Sentinel, can you explain the hospital data? Which organization is organizing these hospitals? He's trying to get a list of the hospitals and counties.
So the data is pulled from the Healthcare Resource Tracking System, which is a statewide system. It's Tennessee Department of Health system. And all of our hospitals participate in that system. And they've been using that for years and years and years. I think we started rolling it out in maybe 2003, 2004. And so they update their bed availability and some different specific information now for COVID every day. And that information is based on each of the participating hospitals, what they're putting into the system. And we are pulling down a weekly picture of the regional information for all those hospitals. So for us, it's Knox County hospitals and then the 15 surrounding county hospitals, a total of 19 hospitals.
From the Compass, will the order being prepared for release this afternoon cover all of the phased reopening plan, with the obvious exception of the House of Worship guidance?
Yes, at least for phase 1, correct?
Yes.
From the Sentinel, we have been asking for the models COVID-like illness and effective transmission rates from the county is using and generating, and this information is not available as a part of your benchmarks. You said you were making it available. Why is it not? And then he's saying this applies to other things that are not in the benchmarks, not just COVID-like illness.
So I think we've put everything that we said we're going to be in our benchmarks on the website, and go back to the models. And again, I had to go back since there's several different ones. So IHME model, the Vanderbilt model, there's the Colorado University model that kind of talks about deaths. There is a local model at University of Tennessee, and then our hospitals have presented us data from some more local specific hospital models. And those are the two that I cannot remember the name of. And I apologize, with everything going on yesterday, we will get you that list today, Vincent, of the models we're looking at. But I'm going to go back to, we are really wanting to look at our local trends, our local picture, and our local data. That is why the models are not a benchmark, because the models aren't fact. They will help guide, and we may consider some of them, but until they start converging and we start seeing some consistency in models, there's too many variables and there's too many different things that they're looking at, and there's too many different models that show different endpoints for us to put all of our eggs in any one model's basket.
All right, we've got just about time for 3 more questions. I see one's already submitted, so the next 2 that are submitted are the ones that we'll be able to take for enough time for today. The one that's currently in there is from WBIR. It says, Dr. Buchanan told commissioners there are no current antibody tests that are to be used for patient care or for diagnostics, and they're not even that reliable for telling someone right now if they've had the disease. Some places are starting to offer it in Knox County already. Should people be getting those tests, and what can they tell us?
So we urge caution with those. We know they're available. Tennessee Department of Health put out a health alert network information to providers on that, really urging caution in use of those, because there are so many questions about the reliability of those tests. And so again, they may be helpful and useful, and some communities are for epidemiological data, burden in the community, but not for patient diagnosis, care, treatment. All of those things should not be made based on antibody test results.
I said we had time for about 2 more questions. I don't see any more submitted in here. Were there any other questions? Got just a couple minutes. All right, if there's no further questions, oh, we just got the last question. I'm sorry, as I'm saying that. All right, the last question is, what is the local effective transmission And how are you calculating it? That was something I asked for, and it is not part of the benchmark information.
It's not actually, I don't believe, in the benchmark information, but I'm asking for it. The Vanderbilt model says it was below 1, I believe. That's probably pretty accurate given our local circumstances, but it's not in the benchmarks, and we're providing all the information that are listed in the benchmarks on our website.
All right, to be honest and transparent, because I said 2 more, we did get the last question in here from WBIR, just to follow up to their previous question. Is there any benefit to getting an antibody test or reason to get one if someone hasn't had any symptoms?
You know, we really aren't encouraging those right now at this time. There are other testing opportunities, and you can get the traditional PCR method. There's also some other studies that are being done, but at this time, the standard is the PCR.
Okay, great. Thank you, everybody. We appreciate it, and we will see you Monday at 12:30.